Hi, I'm Marie Hopkinson, Chinese medicine practitioner. I'm an acupuncturist and a herbalist. And today I want to talk to you about a question someone asked on the channel about wind. Can you talk about wind? Now, it's not wind as in wind from your backside, but wind is a common diagnosis in Chinese medicine. So what I'm going to do today is I'll just unpack this idea a little bit and we'll go into it a little bit deeper. And if you have questions about wind or something else about Chinese medicine, you can also pop that question in the comments. I love seeing people's questions and I'll do my best to answer your questions about Chinese medicine. Welcome back to the Chinese Medicine Podcast. And if you're new to the channel and you haven't subscribed yet, then what are you doing? Make sure you subscribe. If you don't subscribe, you might miss out on some interesting content. The internet's a big place and sometimes we just get lost in it. So don't forget to subscribe, and that way we're on the health journey together. I love answering questions. So today's video is actually answering a subscriber's question. And what I would like to do is help more people with the channel. So that's why I want to reach 1,000 subscribers, because I'd like to help 1,000 people with these videos. So if you can share the videos to your friends and family, if there's something that you'd like me to make a video on. What this channel is about is teaching people and helping people to understand what Chinese medicine is and how it can help you in your health journey, and just to be a better person, to live a better life, and using things that Chinese medicine it's ingrained in Oriental culture. So sometimes lots of Asian cultures have this stuff ingrained into them, like healthy diet, exercise therapies, lifestyle therapies, acupressure. It's just a known thing, and there's so much to know, and I just want to teach people and show people how to use it. So anyway, without further ado, let's get on with the video today. So today's video is about wind. Now, we're not talking about wind as in passing gas wind.
Is it something to do with wind?
Do you just pass?
Did you just
wind?
check?
I had a big curry last night. Ooh, excuse me.
Although that could be part of it.
I'm gassy and I'm loaded.
But wind in Chinese medicine, what is it? So a subscriber question I had was, can you do a video about wind, because I have wind in my body, or I've been told that I have wind in my body. So in Chinese medicine, we have to think, let's just go back a little step further. So first year Chinese medicine school, if you were there studying it, you would be told that there's external causes of disease and there's internal causes of disease. So that means that illness or disharmony in our body can be caused by the environment, and it can be caused by our own body. Now, essentially what that means, there's six external causes. So wind, cold, dampness, heat, summer heat, dryness. Those are the external causes. And the internal causes is like emotions, diet, and then you have like miscellaneous causes, which is kind of not really internal, but it's not from the 6 environmental causes. It's more like you ran out onto the street and accidentally got run over by a bus or something, or you lifted a box and hurt your back. They are what we call miscellaneous causes. So, without going into too much detail about all those different things. So where does wind fit in? So wind can fit in the external environment. That's probably the best places to talk about it in that environment first, and then talk about how it could be made, like how it could occur in an internal environment as well. One part of Chinese medicine is thinking of it as an observational system. So that's how the environmental causes are definitely talked about, and it's easy to see the wind. You can't actually grab the wind and capture the wind, but you can see the effects of the wind. Wind moves. That's one thing that it does. It moves around. It moves things around. If it's very, very windy, you can't leave even something heavy on a desk. If it's very windy, it'll be blown away. It'll be moved. So that's one of the effects in our body. So when we have wind in our body, we have abnormal movements, or what can happen is the problem thing can move around. It can shift around. So a common diagnosis in Chinese medicine would be wind damp, or wind cold, or wind heat. And so what that means is those two pathogens are combining and the wind is kind of moving it around. So let's say wind damp in the joints would be a kind of obstruction syndrome where you've got pain in the joints, kind of similar to arthritis. Like a lot of people with arthritis could have a wind damp pattern. It doesn't mean if you have arthritis you do have a wind damp pattern, but wind damp can be seen in arthritis. So let's say you've got pain in the joints And sometimes it's here, sometimes it's here, sometimes it's in your back, sometimes it's kind of moving around. Well, that's a symptom of wind moving around. Wind also causes abnormal movements within our body, and so things like tremors, quivering, twitching, and you often see it in the eyes. So twitching in the eyes is a wind symptom. Now, wind is basically carries the other pathogen with it. So often when we talk about wind and cold, it's really the symptoms of cold that we get in our body, but the wind brings it into our body. So wind cold is a really good example to talk about because it's very easy to understand it. Like if you've ever woken up in the morning with a stiff neck, in Chinese medicine, we would often consider that to be what we call wind cold invading your neck, wind cold invading the tai yang, the channel, the bladder channel at the back of your head. So what is that? What's the tai yang? What's wind cold invading? What do you mean, Marie? So what happens is when you go to sleep, you should be covered over, right? And so if it's cold, you should cover the areas of your body that are cold. Now, I live in Perth, Western Australia, beautiful sunny Australia, and it is often very hot at night, and often people wake up in the morning with a wind cold attack on a summer night. Well, how the hell could that happen, Marie? You just said it's wind cold and it's a hot night. What happens is you go to bed hot and maybe sweating, and so you've either got the air conditioning on, or you've got the fan on in the room, or you've got the window open. And so you might hardly even be able to go to sleep because you're so hot, and because you're sweating, your pores are open and you may not have enough clothes covering you, but you fall asleep fine. But then in the middle of the night, if the temperature drops, now where I live in Perth, that often happens. So it's hot, and then it's, the temperature drops around 4 or 5 o'clock in the morning, it gets a lot colder. And so it might just drop enough, and then because your pores are open, and you might have pulled the covers off or not have any clothes on the top half of you, and then the wind cold can kind of invade. And what happens is you wake up in the morning with like a stiff neck, and you like torticollis, it means. So your neck's sort of pulled to one side, you're sort of like, oh, I can't hardly move it. So that's a good example of wind. Now, wind usually is associated with sudden things. So a sudden occurrence. It's just like yesterday I was fine, and then today it's like all of a sudden this happened. Another good example of wind in Chinese medicine would be a condition that's known as Bell's palsy, which is where all of a sudden the facial muscle contracts in your face. Actually, it's affecting your nerve in your face, and you'll get like this basically. So this is where you've had so much Bell's palsy, and so that would be a very extreme example. One-sided. I don't know. I must have more control over that side because I can do a good Bell's palsy face on that side. Kind of on that side as well. So basically, what happens is they cannot. So they're stuck like this, and the sounds they make with their mouth might change because they just can't. This whole area's in a spasm. There used to be an old wives' tale going around. My parents are baby boomers, and their parents would have said this to them: "Don't pull a face in the wind, although the winds might change, and you'll be stuck like that." Now, that's an old wives' tale, but there is some truth to that. And I remember being in Chinese medicine school and being told that, and I was thinking, oh, that sounds just now it's making it sound so much more unscientific. In Western medical textbooks, they also state they don't know what the cause of Bell's palsy is. Like, they know one of the causes could be a cold blast of wind to the face, because there's enough reporting of evidence for people to say that. Could it be stress? Could it be and we'll look into why wind attacks some people in certain ways, or why wind affects people in different, not like, so two people could go out in the wind, one gets Bell's palsy and the other doesn't, right? So why does that happen? We'll discuss that in a minute. So basically, wind, in that situation, wind invades, and wind causes, it's the wind and the cold causes contraction, and the wind's causing that abnormal movement, that spasming, and sometimes people can even get like an eye twitch from wind. It wouldn't be with Bell's palsy, but it can happen. I've had several patients that have come in just with an eye twitch, and it's basically the way we think about it, treating it is through wind. Often that can be what we call internal wind, which we'll get to in a minute as well. There's a lot to get to. So why do some people get affected by wind and cold, or wind and heat, or wind, and others don't? So like I said at the beginning, the causes of illness are the environment and the internal environment of our body, so those two environments. And essentially why the external environment causes an illness in our body or causes disharmony is because our body, it's an inability of our body to cope with that environment. Now that can happen because the environment just becomes extreme, right? Like, so let's say it's a blizzard and you don't wear enough clothes, or you don't even know anything about blizzards. Like where I live, we don't have blizzards. So if I went to a place where there was a blizzard, I wouldn't know how to protect myself against it. I'd just go out in my normal clothes, my t-shirt, my thongs. Not really. But let's say that I did. I wouldn't be adequately prepared for that environment, and nor would my body be used to it. And so it would make sense that from a Chinese medicine perspective, that I would get more affected by that environment than someone who's used to living in that environment. So that can happen like this. The environment's too extreme than what you're used to. The environment, you're not prepared for the environment, or just extreme situations. So extreme weather conditions, out of season weather conditions really affects our body. So when it's like, you have summer and you have winter, those are two kind of opposites. And you have autumn and spring, which kind of transition us to it. You don't just wake up one day from the middle of winter and it's like the middle of summer. That would be an extreme. Now, sometimes the environment does change like that. Like, or you might have an extreme, what we'd say, oh, this weather's out of season. And it's not just Chinese medicine that acknowledges that. You can see that in people, like, you know, a lot of people talk about the weather. Why? Because it affects our body, whether we're thinking about it like medically or not, it does affect our body. And so if it's very cold and if you're not used to it being cold, then people won't be prepared with the right amount of clothes. That can happen. Or it's there's no transition to it. I don't know if you've ever traveled overseas and you've gone from one extreme temperature to another extreme temperature, but that would be a good example of like not being prepared, not being ready for it. I remember once when I first went to China, I traveled through Hong Kong. And I came from Perth, which was fairly cold at the time. I basically had this parka on, and it was my first time to travel overseas by myself. So I didn't know, I didn't know what I was doing, and I had to spend a night in Hong Kong at an airport before I went basically flew to Shanghai and Hangzhou. Got my bags, and I had a backpack. And so I put my jacket on, which was a massive puff jacket, big thick puff jacket. And I put my backpack on and I strapped it all up because I was worried being like, I would have been 21 or 22. I think I would have just turned 22. Anyway, so I was young and I was alone. And I'd never been to an Asian country. I'd never been to Hong Kong before. And so I basically had my puffer jacket and I had my backpack on. I strapped it all up so that, I was basically strapped up like Fort Knox. And I had to walk across this airport link thing to the hotel, which was just across literally across the road, but in one of these kind of tunnel things. But it was exposed to the environment, and I didn't realize how hot it would be and how humid it would be. I couldn't walk across that thing. I was nearly going to pass out because I had so many jackets and stuff on, and I was all strapped up, and I was like panicking. I couldn't breathe from the air, and I was like, had to stop, take off my backpack, which was a big deal, and take off this big giant jacket, and then put my backpack back on and continue on my journey because it was so hot and I wasn't prepared for it. I wasn't prepared mentally for it. That's one thing, but I wasn't prepared physically. I was dressed way too warm because I'd come from a cold place. So that's one example. So you can get sick from being in an environment where the environment is very extreme, or you're just not prepared for that environment. And so that's how wind can affect us. Like you might be out sometimes. I think you, as a Chinese medicine student and a practitioner, you become very, very aware of this, and you sort of like go, oh, I must wear my scarf and I must sort of protect myself from the wind, because you get sort of scared of the wind when you're studying it, because you hear so much about, oh, the wind can make you sick and all this sort of stuff. But you see people go out and they don't have enough clothes on, and you think, are you just super hot and you can't feel that? Would you just not care about that? And so yeah, it's something where you're kind of very much aware of it and sort of become hyper vigilant to it. So that's one thing about wind. So wind either brings that heat in or brings that cold into your body, and causes that problem to happen. And certainly from a TCM perspective, they think wind combines with those different pathogens. In classical Chinese medicine, we tend to think of things more in just of a wind-cold effect, and then that heat happens because of things transforming. So initially, when you get sick, we're talking about like colds and flus now. when you get sick with colds and flus, that external environment is just the wind cold that happens first, and then your body can create heat inside it because it's trying to get rid of that wind and cold. So I think this subscriber's question was more about internal wind, just from the general gist of it. I mean, I don't know exactly, so that's why I'm giving you this kind of bigger overview of wind. So wind can also be what we say internally engendered or internally generated. So what that means is the element that's responsible for that, or the element that would be out of balance in that situation, would be the wood element. So in the Neijing, whenever they mention wood and wind, those two things are like an interchangeable term. So what it means is that like wood in our body, the wood element is the wind of our body. The wind, the good wind of the body, let's say. So just almost like the Wicked Witch of the East and the Good Witch in the Wizard of Oz. So if that wind gets out of control in our body, it becomes the Wicked Witch. It becomes negative wind in a way. Like it's not healthy for our body. It's not helpful to our body. But we do need wind in terms of we need movement. So that peristalsis in our body, that's movement. The movement that happens in our body that causes us to have creative thoughts, and that causes us to have that generation of new things and ideas and that sort of stuff in an emotional sense, that's all a wood element aspect. And that's like, the movement, and the wood is benefited by movement. Like if you're a person who's a gym junkie and you've got what they would call in TCM liver chi stagnation, then, and you can check out my other videos on liver chi stagnation if you're interested in that stuff, then that's a sort of person who, like, they're by what they're saying, what TCM's saying when they're saying liver chi stagnation, liver energy, which is the functionality of wood, is almost that it's not able to generate the wind, the good wind. It's not able to generate that movement that's needed to kind of get those cycles going and perpetuate the proper cycles in your body. And so what can happen is that wood can get out of control, and you might have seen some of my other videos on mentioning 5 elements. And how does that get out of control? Well, it doesn't just suddenly like wake up one day and go, whoa, out of control. It could happen because of diet. It could happen because of lifestyle things. It could happen because something else, one of those things has affected the other elements, and then that's affecting wood. So you have wood, fire, earth, metal, and water. See if we can put them on the screen here next to me. So basically, wood can be affected by water. So water nourishes wood. So what can happen is, this is very common for people who are like a creative person or a very driven person, a go sort of person. If they don't allow some nourishment of water to wood, water is like stillness, okay? It's flowing, it's moisturizing. And what happens, like wood should bend and flex and move, right? Wood out of balance, wood without water kind of nourishing it, means that wood becomes stiff, and as it tries to bend, it snaps, and that's not good, right? That's not good. And so the wood element in TCM relates to the liver organ, which relates to your tendons and the sinews, which is the ends of the muscle. So you have your muscle, and then you have those tendons which attach onto the bone. And so that whole bending and flexing is relating to, if people who have very flexible tendons, who have, that means that they're allowing water, or that water is allowed to nourish the wood. And the same as with a tree. So a tree that's dying is basically, becoming a tree that bends and snaps. It's not bending and flexing. A tree that's new, a tree that's shooting out of the ground, is green. And that's why wood in the 5 elements is represented by green. There you go, that's for free. And so it's like this bending, flexible, it's this flexibility of wood, showing you, the 5 element model is showing you that wood is nourished by water. So if that's not happening, then, and that could be someone who's got bad sleep as well. So sleep is a way that we nourish our water. It's a way that we nourish blood, and we like basically it's actually the wood element that helps us to nourish blood, but it needs that nourishment of water to be able to do that. So if you don't have good sleep, then that would be something that could affect it, and that it causes a problem in Chinese medicine called liver blood deficiency, or let's just call it blood deficiency. So if a person's blood is deficient in Chinese medicine, it means it's not good quality blood. It doesn't mean that they don't have enough blood volume. Okay, they still have, in a physiological sense, it's not like they've lost a litre of blood, although losing a litre of blood could cause you to have a liver blood deficiency situation in a Chinese medicine sense. So what that means is that the blood isn't as good quality. So when the blood goes to the places, because that's how we heal our body. So if you have stiff tendons, let's say, because water's not able to nourish wood, it makes sense from that blood nourishment perspective that, you know, blood flow getting to that area isn't as nourishing. And this is one reason why I encourage patients to take herbs when they're blood deficient. If they're, let's say they come in for a tendon problem, like any kind of a back pain or something like that, and you check their pulse and it's very weak and thin and wiry, and especially on the liver position, which is on the left side of the body, if that pulse is even very faint, it's like you can hardly feel it or something like that, and it's enough for you to know that person's on the deficient side, then acupuncture can help in a way, but it's not going to solve the problem, because you can only get the flow of what their body's already got there to that area. And so herbs is what's needed usually to nourish blood, so that then their body can make better quality blood. And then when you do the acupuncture, the better quality blood's kind of getting to those areas, and that's kind of work hand in hand really well together like that. So that's just an aside thing. So I'm trying to stick to this question about wind. Well, they're both the same thing, but now that you know that. But this question about wind. So when wind is engendered internally, it can often happen because a person already has that blood deficiency. And one way to know that is a person who's afraid of the wind like a blood deficient person is often afraid of the wind. What that means is if you go to a place where it's very windy and there's a group of you, the person who's more blood deficient is going to say, oh, I don't like being out here, it's too windy, I'm going to go inside. Or, oh, wow, aren't you guys cold? It's so windy. Look, it's not always females, but it's often female, because females tend to get more blood deficient than men, just because they get periods and they lose blood all the time through their menstrual cycle. So that's one way that you can get blood deficient. And it's not so much just like having a regular normal period, but having periods that are too heavy or excessive bleeding or any of those kind of problems. So anything where you've lost too much blood, or you've had a lot of clots in your period or something like that. So that could be one way, or someone who's had a lot of surgery or had a lot of chronic illness that's caused their body to basically consume more of its resource in order to try to heal that area. And so it's pulling its resource in there, and then overall it's become blood deficient. Or someone with a bad diet that doesn't have, now I don't want to say that so blatantly, like, bad diet, because what does that mean? So you're going to have to go and watch another diet video that I've done. Go and watch the video called Why Eat Mostly Cooked Foods. And that'll explain to you the general diet. So if they eat mostly cold, dry and raw foods, and they don't eat warm, cooked and moist foods, then that eventually would probably lead to a blood deficiency. Someone who's explicitly vegan, that could lead to a blood deficiency, especially someone who's vegan who then also eats a lot of cold, dry and raw. That could lead to a blood deficiency. It doesn't always, but it can do. And there are some constitutions of people that are born with a propensity for something to happen more than others, which is why we have body types in Chinese medicine, where you like physiologically, you have people that are more prone to dampness. You have physiologically people that are more prone to be, like we're talking about wood and wind today, so woody and windy type of people. So woody type of people, very sinewy, and that like that, so that they can tend to be very thin, and their body can tend to be dry and sinewy and that kind of thing. So wind can happen internally because a person can have a blood deficiency. So symptoms of blood deficiency, apart from the pulse being like weak and thin, and like there's other aspects to it in different positions that would be like that, particularly on the liver position. They might have pale skin, pale face, dizzy, lightheadedness, that kind of stuff. Now, it doesn't mean that all people who have dizziness have blood deficiency. In Chinese medicine, pattern diagnosis has to be a certain amount of symptoms, or enough symptoms in one area to make that diagnosis. And that's really where your Chinese medicine practitioner comes into it. So if you're watching this video and you think, oh, this sounds really interesting, Maria, I wonder what's wrong with me. I wonder what pattern I have. Or I wonder how Chinese medicine would explain my symptoms. Then go and find a Chinese medicine practitioner. If you're not sure how to find one, then pop a comment in the comments below, or send me an email with your where you live, because I know lots of people watching my videos aren't where I live. You need to find someone who's nearby you. One is because they're going to need to check your pulse, and that's, you just can't get away from doing Chinese medicine properly without that. And so also if you're going to do acupuncture treatment, they're going to want to do the treatment on you. They can't do the acupuncture through the internet yet. So you need to find someone who's nearby you, and I can help you get in contact with practitioners that I know of around the world that practice the same kind of system that I do. That's one way. Or you can just go on Google and look for someone. I've also even made a video about how to find a good acupuncturist or a good herbalist on here, to kind of help suit your needs and your what you should look for in finding a good practitioner. So I hope this video has been useful to you. If it has, don't forget to subscribe. Click that notification bell so that you can be notified at all times when my videos come out, because it's such great content and they're so good. And thanks so much for watching.